Mixed reactions greet the newly appointed Health Secretary Ted Herbosa, while some medical groups recognize his qualifications as former health undersecretary. Some militant healthcare workers are dismayed with his appointment. For his comeback, Defense Secretary Gibo Teodoro gets support from the military due to his previous track record. Some expect him to pursue defense diplomacy and strategic thinking in ensuring the country's security. Good evening, I'm Ruth Cabal, sitting in for Pia Ontiveros. Welcome to your weekly political appointment fix, politics as usual. A group of doctors have expressed their support for the country's new health secretary because of his vast experience. On the other hand, critics enumerated the reasons behind their opposition to Herbosa's appointment. These include his supposed promotion of privatization of some public hospitals. Herbosa immediately countered the allegations against him.
I never pushed for privatization. I was sent by the previous administration to study public-private partnerships in healthcare, which is being done ng lahat ng bansa ngayon. All countries are looking at the private sector. In fact, sa Pilipinas, mas malaki na ang private sector sa public sector.
Herbosa vows to expand access to healthcare services, especially for the poor, honor the service of healthcare workers in the country, and address issues the administration wants to resolve, including increasing cases of tuberculosis, teenage pregnancy, and HIV among the youth. Our guests tonight, former Health Secretary and Iloilo 1st District Representative Janet Garin. We also have in the show former National Security Advisor Clarita Carlos. Let's go first to Congresswoman Garin. Good evening to you and thank you for joining us. Congresswoman, can you hear us?
Thank you, Ruth. Good evening.
Yes. Congresswoman, as a former health chief also, how would you...
Yes, I can hear you.
Yes, okay. What can you say about the appointment of Secretary Herbosa?
Well, we respect the prerogative of the president. Ahead lies a big challenge for Secretary Ted Herbosa, considering that post-pandemic, we just don't need to recover, but there are a lot of public health challenges, especially so that healthcare and DOH has been beset with a lot of challenges related to fake news, what is globally known now as infodemic. And this is something that should really be addressed.
It's interesting lang, Congresswoman, why you mentioned yung fake news or what you call infodemic. Bakit po yan isang malaking concern for you that the new secretary should address?
That's not only a concern of yours truly, it's a concern of the whole of the global medical society, not only in the Philippines, but including other countries, because this has affected a lot of public health programs. We talk about family planning, as you mentioned earlier, that the provision of services is one of the priorities of Secretary Herbosa, and that has again been a victim of many infodemic. Even the fight among doctors, among even vaccination has been a victim of infodemic. There is a lot of confusion. When we talk about universal health care and public health, the knowledge and participation of the people is very important. That is why infodemic should be addressed, because we are at a time, we are at the crossroads where people would have the tendency to check information online, check the internet, and compare what their doctors are saying. So marami na po ang nagdidesisyon base sa kanilang nakikita sa social media. And this has affected a lot of our public health programs. That's why it's a huge challenge, because whatever the government does, if there are a lot of experts coming out who turn to be non-experts, then confusion is there, and it affects public health programs. It affects implementation of universal health care.
Congresswoman, when the appointment of Secretary Herbosa was announced, a lot of some of his critics immediately gave out their statements. In particular, itong alliance of health workers. They were saying that he doesn't fit the bill of what a health secretary should be, yung pro-people, pro-health workers, and responsive to legitimate issues. Kayo po, how would you assess the track record of Secretary Herbosa? Kasi he was also an undersecretary in the Health Department. Nag-abot po ba kayo under President Aquino?
Well, he was undersecretary since the assumption of former President Noynoy Aquino. And when I became USEC, I had the opportunity of interacting with him for a short time. No? Unfortunately, when I became secretary, his being undersecretary was he was, I believe, he went back to the University of the Philippines because he was with the DOH on a secondment contract. No, I'm not really privy to his prior contracts. But then on the issue of allegations from the Alliance of Healthcare Workers, on a personal note, and being a former secretary myself, I would look at those as challenges that Secretary Herbosa should disprove.
Kasi yung isa pang sinasabi nila, although Secretary Herbosa already addressed this, yung supposed to be, he encouraged yung privatization of some government hospitals.
Well, if my memory recalls me right, Secretary Herbosa was USEC at the time, was in charge of PPP or public-private partnership. There's actually a huge difference between PPP and privatization. And this should be clarified. While I do believe in public-private partnership in some aspects, privatization will be a no-no in the delivery of healthcare. Simply because when you privatize something, services will become more expensive. And in a country where the out-of-pocket expenditure is 60 to 70%, privatizing healthcare will be very detrimental to the implementation of universal healthcare. On the other hand, PPP, public-private partnership, can actually be done selectively. And this can be done, let's say, in management of specialty centers. The management can be privatized, but the facility should still be owned by the government. Because if you do PPP in a situation where public-private partnership will transcend to actual privatization, then the general public will be on a very difficult situation because the out-of-pocket expenditure, which is already around 60 to 70%, will be higher in terms of absolute numbers. Ang ibig sabihin natin dito, mas magiging mahal ang kalusugan. At dito naman sa ating bansa, wala naman po kasi tayo sa sitwasyon ng iba that healthcare insurances would play a huge and an important role.
In terms of pandemic recovery, paano po kaya? Anong dapat tutukan ni Secretary Herbosa?
We are not wala na po tayo sa situation na tinatawag natin public health emergency of international concern. Na ibig sabihin, hindi na po tayo dapat sumandal sa ibang bansa. So medicines should be made available for free to the general public. We need to live with COVID. We need to balance healthcare and the economy. And in so doing, hindi naman tayo pwedeng magsara. Sa pagbukas natin, patuloy pa rin na may magkakasakit. Nandoon pa rin yung importansya ng high vaccination coverage coupled with free medicines, especially antivirals, kasi yan po ang napakamahal for those who need it.
Okay. Congresswoman Garin will still be with us. We'll be back after a quick break. Stay tuned. Welcome back. This is Politics as Usual. Expectations are high as Secretary Gibo Teodoro returns to the Defense Department. Teodoro says he will lobby in Congress for more funds to help strengthen national and civil defense. He will also find ways to ensure sustainability of pension for military and uniformed personnel.
Our territory is our territory. And UNCLOS, the basis of that, cannot be changed by the passage of time nor changes in administrations.
Our next guest is former National Security Advisor Clarita Carlos. Good evening to you, Professor, and glad to have you with us. Professor.
Hi, good evening, Ruth. How are you?
I'm good, ma'am. Ito po, yung appointment po kay former Secretary and now again, Defense Secretary Teodoro, what can you say? How do you assess his track record for the position?
Well, he has been there before, and he's a true blue scholar. Took his Master of Laws at Harvard, and sterling academic background. But I hope he will be able to shift the views of many of the people around him who are still in a Cold War mindset.
When you say Cold War mindset, ano po ba dapat ang maging mindset nito pagpasok ngayon ni Secretary Teodoro?
Well, this was one of the last memos I sent to the president when I was still National Security Advisor, Ruth. And it really was proposing multi-alignment. Do not lean on any one hegemon or superpower, but we should in fact spread our alignment, whether it's for commerce, trade, security, and defense, towards a multipolar world, really, is the platform that we're working on. So that nothing should prevent us from joining the BRICS, the Shanghai Cooperation Organization, and the like. So this will, demolish the many emerging perception that we are just leaning towards the Americans.
Aside from that, Professor, kasi kanina I was watching the press conference of Secretary Teodoro, and one of the things he mentioned na parang marching order daw the President Marcos was to work with the legislature, the AFP personnel, and then to ensure that there will be a sustainable military and uniformed personnel pension. Isa po kasi ito sa malaking usapin sa ngayon, Professor.
Yes, Ruth. I'm glad he mentioned that. Hindi ko rin kasi napanood yan because I'm now Chief Policy Advisor on Security to Speaker Martin Romualdez. And I just submitted to him before the recess a security sector agenda for legislation. No? And that will cover reform for all law enforcement, including the AFP, the PNP, and attached agencies. So I think Secretary Teodoro and I will be on the same page in regard to this, and I hope I can set up an appointment with him as soon as possible so I can discuss the security sector reform with him.
Sa tingin niyo ba, I remember when you left the cabinet, you were mentioning President Marcos was telling you things about that were of national security, kaya hindi niyo mabanggit, no? Kung ano man ho yung mga bagay na sinabi sa inyo noon ni President Marcos, do you think that Secretary Teodoro can resolve those or can handle those?
I don't know that he can handle those. Well, first of all, Ruth, he does not do security and defense policies. Gawa yun ng presidente. Siya nag-i-implement nun. Pero nagpo-provide siya ng guidance kasi yung data nanggagaling sa kanya. AFP and all the armed services. No? But I know that we've been together so many times with Secretary Teodoro. I've done them with him in many lectures. And we're both scholars, and I think we will be on the same page on most things. No? As regards to national security issue, unfortunately, Ruth, we cannot go there.
And then yung isa pa, ma'am, because you also mentioned na parang since the Marcos administration, pangatlo po siya na to be designated as head of defense, but then the first to be formally appointed as secretary. Pero civilian nga po siya. The two others were military, former chiefs of staff. So do you think going into all these issues, kakayanin po niya yung policy direction na gusto ng Marcos administration?
Definitely. I suppose you remember, Ruth, those are the same issues that were leveled against me when I became president of the National Defense College. Bakit babae? Bakit civilian? Diba? Pero we demolished all those arguments, diba, on the ground. Now, ganun din ang naging argumento sa NSA. Bakit babae? Bakit civilian? No? I don't think it has anything to do with being civilian or military because Teodoro has all the expertise around him and all the commanders of the all armed services if he wants, data on the ground. So his being civilian really should not matter.
Siguro before we go to a break, Professor, your solicited advice as former National Security Advisor to Defense Secretary Teodoro.
Unsolicited, Ruth.
Yeah.
Of course, you know that EDCA has increased to 9. No? dapat magkaroon ng sub-IRR yan. Kasi yung team ko yung gumawa ng IRR ng BFA eh. And yung IRR ng BFA, hindi niya masasaklawan yung EDCA kasi iba yung pinapag-usapan sa EDCA although nakatukod dyan sa BFA. So I hope one of the things, siguro when I meet with him, I will discuss it with him, to have a sub-IRR ng EDCA para wala na namang hindi pagkakaintindihan between us and the Americans.
Very particular yun, na sana ma-discuss nyo rin po yung sinasabi nyo for EDCA, ma'am. We'll have more from our guests when we return. This is Politics as Usual. You're still with Politics as Usual. We're discussing the newly appointed cabinet members, Health Secretary Ted Herbosa and Defense Secretary Gibo Teodoro. Let's get to the final words from our guests in terms of the direction the administration is taking with more appointments and other vacant posts expected. Siguro parang na rin to, pre-SONA. Let's start with Congresswoman Garin. Parang is the president on his way to getting the best and the brightest now for his cabinet, for his official family?
Well, it's very difficult to judge an appointee, before they assume office or before they prove to us their capability. So I leave it to the general public and to all of us to measure their capability through their achievements.
Si former National Security Advisor Clarita Carlos, dati po kayong cabinet member. Sa tingin niyo ba 1 year into the Marcos administration, tama po ba ang direksyon ng kanyang cabinet members?
You know, Ruth, sometimes we think it's very easy to vet people for various positions. But remember, the president is filling up more than 5,000 positions, no? And the cabinet secretaries are on top of the whole hierarchy. So I can see as a social scientist how difficult that would be. Many times you think that the sterling academic records of a person is enough for her to be given an appointment. But it seems there are other political forces that will be working against that person whom you have appointed. So expertise may not be enough. Of course, being a manager, I see is a must. Never mind that you have the expertise or the discipline behind you in the position that you have been given. But if you are not a manager, then you're lost. So I hope the president will give a very high premium on the managerial skills of the people whom he still has to appoint.
And with that, we'd like to thank our guests, Congresswoman Janet Garin and Professor Clarita Carlos. We've been told before, don't talk politics at the dinner table or at a family reunion or in Viber groups and risk warfare, digital or otherwise. But we can talk about it here at this table on this show. Your weekly political appointment fix, Politics as Usual. For Pia Ontiveros, I'm Ruth Cabal. See you back here next Wednesday at 8 p.m. Good evening.